My name is Dicky. I'm an endocrinologist from Jakarta, Indonesia. And today I would like to share about the condition of obesity and diabetes in Indonesia. So not only in the worldwide, in Indonesia, we also had the problem of dual problem of obesity and type 2 diabetes. So if we zoom in into the problem of obesity in Indonesia, our recent basic health research revealed that 1 out of 3 Indonesian adult populations actually suffered from obesity. And if you look into the data presented at the World Obesity Atlas, you can appreciate there is an increase in terms of obesity prevalence across the year. You can see currently among 1/3 of the Indonesian adult population suffered from obesity. And if there is no appropriate management, this prevalence would increase every year. Based on the recent basic health research data on the cardiometabolic risk factors in Indonesia, about 1/3 of Indonesian population had obesity. And the similar numbers also goes for pre-diabetes, also for hypertension, and also for dyslipidemia. So among 1/3 of the Indonesian adult population suffered from metabolic syndrome, which is a clustering of risk factors which later on could lead to the increasing prevalence of type 2 diabetes, cardiovascular disease, as well as mortality. Regarding the obesity, the Indonesian Society for the Study of Obesity has recently proposed a new guidelines for the diagnosis of obesity. The first one would be we are using the different cutoff point for the diagnosis of obesity. We are using the BMI of 25 kilogram per meter square. And now we want to advocate the use of complication-based diagnosis for obesity to use the Edmonton obesity staging system. And for central obesity, we are also using a lower cutoff point for the diagnosis of central obesity. So in terms for the diagnosis of obesity, in Indonesia, we are using a different set of cutoff point for the body mass index. Here, we are using the cutoff point for obesity of the BMI 23 for overweight and BMI of 25 for obesity. Not only on the diagnosis, on the criteria for anthropometric measurements, we also advocate to use the Edmonton obesity staging system for the diagnosis of obesity. So we can diagnose the patients can have either the stage 0 without any evident for the presence of complication of obesity until the stage 4, of which the patient had the severe complications of obesity. Regarding the treatment for obesity, in Indonesia, we use the Obesity South and Southeast Asia consensus. But now we are developing our own guidelines, which hopefully can be published in the next 3 months. So the treatment consists of course, lifestyle modifications, and then pharmacotherapy, and if needed, bariatric surgery. In terms of the obesity pharmacotherapy in Indonesia, the problem is we don't have all available pharmacotherapy in Indonesia. For example, for the long-term management of obesity, which has been FDA approved, in Indonesia we only have the Orlistat. And for GLP-1 agonists, we only have liraglutide. We do also have the semaglutide, but it has not been approved for the treatment of obesity in Indonesia. It only been approved for the treatment of diabetes with obesity. And for the short-term treatment, we only have the diethylpropion for the treatment of obesity. So it is quite challenging to treat obesity in Indonesia because we have a very limited medications to use. And it is important to note as well that obesity has not been recognized as a disease, thus most of this medication were not covered by the insurance, and the patients itself need to pay by themselves. So, as the summary for the problem of obesity in Indonesia, so the prevalence of obesity is increasing. And the second one, the awareness of the obesity also still lacking in terms from the population point of view, as well as from the clinician point of view. And the third one, the optimal diagnosis and management is still lacking. In terms of management, we in Indonesia are still lacking on the treatment options for obesity. Now I would like to switch the gear to diabetes. This data show you the prevalence of diabetes worldwide. And if we can see the data from the Indonesian map here, the prevalence of diabetes has increased from 6.9 to 10.5%, which is in parallel with the increasing prevalence of obesity from 20 to 30%. So the increasing prevalence of obesity also lead to the increasing prevalence of type 2 diabetes. So the problem of obesity in Indonesia is quite huge. If you look into the percentage of people with diabetes in Indonesia, about 70% of them are currently also diagnosed as having obesity. So actually in the previous 10 to 20 years, obesity and diabetes is not that much, but recent data show the other way around, that now we are increasing number of obesity among those with type 2 diabetes mellitus. In terms of diabetes mellitus problem in Indonesia, our recent data show that out of 10 adult people in Indonesia are suffering from diabetes. So this actually translates about 20 million people with diabetes in Indonesia. And the problem is about 86% were unaware about their diabetes. And among those who are aware that they are having diabetes and seek treatment, about 70% still uncontrolled. So these conditions would then lead to a higher diabetes complications. And if we zoom in into the data in terms of the age of the patients, we can see that almost quarter of diabetes patients in Indonesia actually is very young. They age less than 45 years old. So it will further hamper the productivity of diabetes patients. This graph show you the numbers of diabetes complications in Indonesia. You can appreciate there's a huge proportion of diabetic neuropathy. We also a huge prevalence of erectile dysfunctions, also eye complications in 1/3 of the populations, cardiovascular complications about 1/5 of the populations, renal complications 14.5%, food complication 12.4%. But it is important to note, if we did the screening to all the diabetes patients, we can see that almost 40 to 50% of those patients are actually suffering from diabetic kidney complications. And in terms for the fatty liver, if we did the screening, about 45% of diabetes patients in Indonesia are suffering from fatty liver. This graph show you another data from the private hospital setting in Indonesia. You can see that the proportion of people with coronary artery disease is reaching about 1/3 of the diabetes populations. The peripheral arterial disease is about 20% or 1/5 of the populations of diabetes. And for the diabetic kidney disease is almost half of the populations. So the proportion of diabetes patient with complication is very huge. If we look into the data of the medical costs, with the higher number of medical complications, it will then lead to a huge financial burden. And if you can see this, the data from the Indonesian health insurance, you can see here the people with complete diabetes complications leads to a huge increase in terms of diabetes expenditure. And you can see the two disease that is on the first and the second contributor for the expenses is cardiovascular disease and diabetic nephropathy. In this graph, I would like to show you the model of the diabetes care in Indonesia. So we have the primary care level, which is mostly focused on the diabetes prevention and then diagnosis. And then we have the second tier hospital, third tier hospital, and also the advanced care hospital. So it depends on the level. Each hospital are currently taking care different cases of diabetes mellitus. The simplest cases can be taken care at the primary care level, but if they need to be referred to the next level hospital because of complication, they can be referred to the other hospital. In my hospital, in the Dr. Cipto Mankusuma Hospital, is the top tier hospital. It is the National Referral Hospital. We are having the Advanced Diabetes Center, of which in this center we also develop, for example, the precision medicine clinic for diabetes, and also we are developing other treatment, for example, stem cell therapy, and also other treatment. So this is the graph that we are showing you. Is actually a graph that would give you perspective about the research that they are currently working in our hospital, in Cipto Mankusuma Hospital, in collaboration with the Ministry of Health as well as with the Indonesian Medical Education and Research Institute. So now we are developing a bioregistry of patients, diabetes patients with all the complications. We perform the screening, all the diabetes complication, we perform all the screening. And then we also have the bioregistry, and also we collect the sample for the biobanking. And by combining this data from the clinical, laboratory, and then imaging, as well as omics data that we are hoping to be able to generate later on. Right now, we are focusing on the genomics data. Hopefully later on, we can also improve the diagnosis and also risk stratifications for the diabetes in Indonesian population, and hopefully to be able to provide personalized care for our patients. So I think we are on the end of my talk. So obesity and diabetes is a huge burden in Indonesia. For obesity, it's about 1/3 of the Indonesian adult populations, and for diabetes, about 1 out of 10 Indonesian adult populations, and about 70% of diabetes population in Indonesia are currently having obesity as well. So the problem is on the management is still suboptimal. For example, for obesity, we don't have many selections in terms of obesity pharmacotherapy. And for diabetes, and if you want to adhere to the recent guidelines, we need to use the newest medication, for example, SGLT2, GLP-1, and so on. But the problem is, those drugs is still very much expensive to the whole populations. So we need also have a greater access to this drug by providing a more affordable options for obesity and diabetes patients in Indonesia. Thank you for your kind attention.